Hi, everyone. Welcome to Tell Me It Will Be Okay, the podcast for parents of anxious kids and teens. Today's episode, we're going to be talking to Dr. Ali Navidi. I was a little trepidatious when he first reached out because he wanted to talk about kids with GI symptoms and anxiety and treating their GI symptoms. And I get a lot of people who pitch me stuff about probiotics and this diet and that diet and the gut brain connection who clearly actually don't understand how all of that works, who want to come on the show to pitch a diet or a supplement. And I always say no to those because, as any of you know, if you're on social media, there's a whole lot of people who will tell you you can cure anxiety by taking this supplement or eating in this way. And that is simply not true. It's much more complicated than that. Now, I'm not going to say that diet doesn't have anything to do with anxiety because it can. For some people, it does. But again, it's complicated. Something that I have talked about with colleagues and with clients a lot, and I talk about it here in this interview, which is sometimes people have gut problems like celiac disease or IBS, and this contributes to their anxiety, and their anxiety actually contributes to their GI problems as well. It gets very mixed up and complex, and it can be very chicken or egg. So I'm not saying totally ignore what you're putting in your child's body, what they're putting in their body. However, to think that you can cure anxiety simply by eating a certain way or taking a certain supplement is incredibly simplistic. I'm not saying it never happens. I'm saying it's simplistic. Anxiety does not have a one-stop shop easy fix because it's very much brain and body, both of those things. What I like talking about with Ali is that he explains some of this and also explains that some of it is not knowable, but then he shares his treatment. And this part got me really excited because it makes so much sense. I think you will find this incredibly informative. If you want to reach out to him, you can go to gipsychology.com to learn more about what he offers. He has clinicians that are licensed across the country. Okay, let's get right into it. Thank you so much for being here. I was super excited when you reached out about coming because I think that so many people in my audience do not understand how gut health relates to anxiety. Both they sometimes aren't aware of it. They sometimes think it's a really simplistic connection. And you're here to help us understand what's really happening for kids, stomach aches, GI stuff, anxiety.
Yeah,
Yeah.
there's so much to talk about, Dawn. I'm very excited to be here. Let's get started with just maybe some fundamentals, right? So there's this concept of disorders of gut-brain interaction. And in the scientific community, it's well known, this idea, but I don't think many lay people really know what DGBIs are. So disorders of gut-brain interaction. They are these GI disorders that are very, very surprisingly common. And I'm looking over here because I just gave a talk to this very large group of pediatricians in New York. And so I have a slide right on all the stats and stuff like that. So basically, these disorders affect 13 to 20% of children. Think about that. That's 10 to 15 million children in the United States. These are massive, massive problems. And what makes it even more relevant is that kids with anxiety disorders or a history of trauma or a history or current eating disorders or on the autism spectrum, so those four groups, have even increased likelihood that they will have one of these disorders. So if you've got an anxious kid, they're very likely to have one of these GI disorders. So what are we talking about? There's about 10 major diagnoses. Now, I'm not going to go through all of them, but there are these functional nausea and vomiting disorders. So these kids are miserable. They're nauseous, they're vomiting. There's kids with functional pain. So they've got chronic pain, or sometimes they don't have pain, and then it comes unexpectedly. And then there's kids that have problems with defecation. So sometimes pooping their pants, sometimes they're constipated, things like that. And then there's the classic that I think everyone's heard of, which is irritable bowel syndrome, so IBS. And that's another of the disorders within this category of DGBIs. So they're very common. A lot of kids are going to have them. And if you've got an anxious kid, they're going to have them too. But they're also really impairing, and they really affect children's lives in a lot of negative ways. So let me pause, because sometimes I'll talk too much, and see just if you have any questions or comments.
One of the things I'm thinking about is it seems like a chicken and egg thing sometimes. So I think about a client I worked with years ago who was diagnosed later with celiac
Yeah.
and also had anxiety. One of the questions they had for me is, do you think my anxiety came out of the celiac, or the celiac exacerbated the anxiety? And I said, I don't know. And I don't know if it
Yeah.
matters.
Yeah.
But what is your thought about the chicken egg of gut brain
Yeah.
interaction?
I think I don't think you said the wrong thing when you said, I don't know. I think it's very complicated, but I think it can go both ways. So you might have an anxious kid that I'll give you an example of a patient of mine. Nice little girl. I think she was maybe 11, and she got food poisoning. She didn't know it. She ate, she went to bed. She woke up vomiting. Think about that. That's super scary for a kid to wake up feeling like that. It's dark. After that, she developed a disorder of gut-brain interaction. And I can kind of go through the model more in depth, but basically her brain became hyper vigilant about the sensations in her gut. And then whenever she felt a little something in there, her brain freaked out and started catastrophizing. Oh my God, I'm going to vomit. Because now she developed a phobia of vomiting. And then that phobia of vomiting drove all this anxiety through what we call the gut brain axis, which is the connection between the central nervous system and the nervous system that's in the gut. So we have a little brain in there. So all that anxiety is getting transferred into the gut, which is then causing real symptoms, real pain. And she was already, before all this happened, she was already a bit of an anxious kid. What came first? We don't know. But once this system developed, it then caused all this secondary anxiety. And that secondary anxiety just reinforced the problem. Now, she was successfully treated, and that is the good news, that these disorders, while common, are very treatable with very specific types of treatment. And that the key word is specific types of treatment.
And you do CBT, which everybody knows, CBT,
Yeah.
but you also do something else. Can you share about that?
Yeah. And I will. Let me put a caveat on the CBT, because
Okay.
most people know about CBT.
Mhm.
It's well known, and a lot of therapists are trained in it, but a lot of therapists are not trained in gut focused CBT. And that's a problem. If you take a regular vanilla CBT trained therapist and you give them a kid with functional abdominal pain or IBS, they're not going to really know what to do. They're going to know how to treat the secondary anxiety,
Mhm.
like feeling more confident and less anxious in general, but they don't know how to disrupt the cycles and the systems of problems that these patients have. And I bring that up because over the years, many patients have come to me. And when I say, hey, I use CBT, they're like, oh, no, that doesn't work for me. I had a therapist doing CBT and it didn't help my stomach. So, yeah, but were they trained in how to specifically apply that CBT? So that's an important caveat. The other modality of treatment is clinical hypnosis. And It's an amazing treatment with now, I think, over 40 years of research behind it. But very sadly, what most people know about clinical hypnosis is entertainment
Hmm.
hypnosis.
Yeah.
So they know the witchcraft and the mind control and all the stuff in the movies or in a stage show. And all that is very different than clinical hypnosis, and that clinicians have been using it for many years. There's 40 years of research. It started in England. They did research on using clinical hypnosis with patients with these stomach problems. They found it was tremendously successful, and they've been studying it ever since. And every study they do reinforces it works well. In fact, the American College of Gastroenterology, so like the overarching organization that works with all the gastroenterologists, they've written clinical hypnosis and gut focused CBT
Hmm.
into their guidelines for these disorders. So this is established, scientifically based treatment. What we're talking.
And together, you're doing these together.
Yeah, and they're both individually, they're both studied, and then together they're synergistic in the sense that they make each other better.
So I'm going to pull back here for a minute. We talked a
Yeah.
little bit before we got started that the gut brain connection has been, I'll say, it's been messed with and squished up and simplified, often to
Yeah.
sell supplements and essential oils. And we are
Yeah.
not talking about that. We are talking about this scientific evidence that shows that there is a gut brain connection. It's more
Yes.
complex than these other things we'll share.
Yeah.
But then you've also got hypnosis on it, which also
It's missing. Yeah.
culturally is misunderstood.
Right.
So I want parents to be really clear here that you are talking about something that there is a lot of evidence behind.
Yeah.
So
And
let's slow down, and can you explain when people say the stomach is a second brain,
yeah.
what do they mean?
Yeah. And this is the problem with things that become popular. Once they become popular, people want to simplify. People want simple answers, right? Who wouldn't? You've got a problem, you want a simple answer. You don't want to hear that you've got this incredibly complex system that involves your neurons, it involves your HPA axis, it involves hormones, it involves immunological signaling. That this is incredibly complex. Scientists still don't understand even a part of the complexity involved here, right? But we want to simplify it. We want to say, oh, the microbiome. Cool. Okay. And then let's even simplify it further and say this one magic little pill is going to fix your microbiome. We're not there yet. I would love it if we were there, right? Because it's incredibly powerful and it's important, but we're still figuring it out. The science is new and it's so complex, right? So when we talk about going back to I just want to preface all that with that
Yeah.
complexity, right? Go back to the idea of a little brain. We literally have a network of neurons in our stomach that is equivalent to our spinal cord, and
Wow.
probably more neurons than that. I can't remember exactly, but I want to say maybe between 200 million and something. It's a complex, and there's a lot. And there's a lot of complicated things happening in our gut, immunologically, in terms of moving the food through, in terms of digest. Like there's a lot happening down there. And there is a little brain. And it needs to be because, and what they found is even when they sever the connection, which is the vagus nerve, they have a vagotomy for various reasons. Sometimes they have to do it. The stomach operates independently.
Wow.
So
Wow.
it doesn't need the big brain to do its job. Now, things are going to go off track because that connection is so important. But the fact that it can operate independently is pretty startling, right?
Mhm.
So all this is like background, and we're still trying to figure it out. So beware of anyone offering you a simple answer, right? This
Mhm.
pill or this oil is going to do X, Y, or Z. Now, what do we know? We know that the gut up work is still in its infancy, it's still learning. But we know that the brain down work has been around for a while. And that's what I'm talking about here, right? So we know we have initial indications that what's happening in the gut, what's happening in the microbiome affects our mental health. But it's very complex and we're not quite sure all the ins and outs, and we don't really have a good handle yet on how to intervene there,
Okay.
right? But we know it affects it. But we also know that the brain down affects the gut. In fact, the brain down affects the body in amazing ways, but specifically the brain down. And we have tons of research, again, over 40 years. Go into PubMed. PubMed is the national database for all these medical studies. Type
Mhm.
in hypnosis, IBS, you'll get thousands of hits because there's been so many studies done, so many articles written on this. And that's an example.
It's I have a couple of colleagues. We have a consultation group, and one of them is EMDR trained, does a lot of
Yeah.
complex trauma work. The other is hypnosis trained. And
Yeah.
when they get talking in the case consultation, so much of what they're talking about, it's different language for the same kind of thing. And so I think people hear hypnosis and go, "Oh, you're going to make me squawk like a chicken." Actually, the way she describes it is it's like a formal guided meditation to
Yeah.
help unhook connections that have been misaligned. Is that
Yeah. I can give you my little spiel, but what you just described, I wouldn't disagree with. And even more interesting, I think also is I've known many people trained in both who are trainers in hypnosis and trainers in EMDR. I haven't had one disagree with the idea that EMDR is a subset of clinical hypnosis.
that is interesting. And
Yeah.
of course, a lot of EMDR is exposure work.
Yeah. And then, of course, exposure work is just behavioral, cognitive behavioral treatment that, when integrated into hypnosis, becomes more effective, right? So I think of EMDR as a really well written hypnosis protocol.
That's
Yeah.
interesting.
That specifies a lot of contingencies. It says, if this, then do this, and has a lot of well written techniques in it. And that's been studied specifically.
So I don't know if I'm going to pronounce his name right. Joseph Ledoux, Ledoux. He's done a
Okay.
lot of research about brain connection and anxiety.
Wow.
And he was saying that part of it is that somebody who is more prone to anxiety is more sensitive to the feelings that we all might have. So when I'm talking to
Mm,
parents about it, I
yeah.
say there's two of us and we're both waiting to go on a roller coaster and we're getting excited and our stomach's flipping a little bit. And
Yeah.
one person experiences that stomach flipping is I'm really excited. That's how it
Right.
feels to me. And
Right.
somebody else feels it is I'm going to throw up. I feel terrible. This is scaring me. So
Right.
when you're doing this work, is that part of it? Is that you're helping people experience it in a more productive way?
I think you've hit on something super important and something that's almost core to what we're doing in a lot of mind body work, and specifically in the GI work, is this concept of safety.
Mm.
So think about the two people you just described. The difference is they felt the flip, and one of them was like, I'm excited. They interpreted that feeling as excitement. The other one felt the flip and interpreted like, oh, there's something wrong. There's something bad. And then that set in motion a self-reinforcing feedback loop where that anxiety then got transferred into the gut and made those feelings worse. It made everything amplified. And that amplification then fed on itself to the point where they were like, I think I'm going to throw up.
So that patient that you were talking about who woke up in the middle of the night nauseous and throwing up, which
Yeah.
super scary.
Yeah.
Then anytime her stomach started to get a little
Felt a
nervous,
little something.
okay, so she became extra aware of that and extra avoidant of it, which
Yep.
perpetuated it.
Yeah, she was hypervigilant, always scanning. So there's one, two, three, four key elements in understanding the model. So we have two of them already. We've got three. We've got the hypervigilance.
Mhm.
We've got the catastrophizing when they feel something. We've got the gut brain axis, which allows these things to get transferred back and forth. And then the last element is something called visceral hypersensitivity. And visceral hypersensitivity is something that's common to all these disorders of gut brain interaction. And basically, what it is, that patient, let's say, that I was talking about, when she feels something, that feeling isn't just relayed directly and she feels it. It gets relayed to her brain, and then her brain amplifies and distorts it. So instead of maybe feeling a little gas in the morning, she wakes up, she's got a little gas, it feels like pain, or it feels like nausea, or it feels, and it's amplified and it's distorted. So think about how that feeds even more into that anxiety.
Because it's not all in her head. That's not what you're saying.
Right. What I'm saying is that without a head and without a gut, there is no problem. But the way that the two are talking to each other is creating a problem. So these are not problems of inflammation or ulcers or cancer. These are about how the two interact, the brain and the gut. So a good metaphor is, let's say you're listening to some music on your phone, and as a joke, somebody just goes and cranks the volume up really high. And it's startling and it's painful. And even though the music is still good, you experience it as unpleasant and upsetting. That's what's happening here. Their gut is good, their brain is good, but the way that the two are talking to each other isn't working because all that hypervigilance and catastrophizing makes the gut upset. And then all the gut sensations are being amplified and distorted by the brain. So it's like this old married couple that are like always pissing each other off, right?
So let's say this patient, their parent brings them to you.
Yeah.
How do you start working with them?
Yeah. And the last thing I'd say related to your comment is the symptoms are 100% real. This is pain that's as real as any pain. This is nausea that's as real as any nausea. These are like the vomiting is real, the diarrhea, all of it is real. And so I want to make that very clear.
That is good because I know these are also kids. School avoidance becomes an issue because they're
Yes.
always in the nurse's office with the stomach ache.
Yes.
They're not faking it. That's not,
No, they're
yeah.
not faking it. And the brain is involved, but we're not in charge of everything the brain does,
Yeah.
right?
And so parents are stuck in this place where, they're trying to figure out how to handle it. Now, the first thing I always tell them to do is go and make sure there's nothing medically going on, right? Yeah,
Yes. Yes.
absolutely. And then we find out there's not, and then they come to you.
Yes. They come to us, and the first intervention we do is good education. So we would go through in detail what we talked about with the parents and have them understand the nature of the problem. The model that I was just, and we have pictures and we're showing them. And once the parents understand, then we explain it to the child in child-friendly way. And just that education is an intervention, and it will start the process of healing. The next step then is to explain, okay, what are the tools we're going to use? How is CBT going to help? How is clinical hypnosis going to help? What is clinical hypnosis? What is it not? And so explaining all that. Then the next step is probably one of the funnest for me, is we give the kids some tests on what kind of talent they have for clinical hypnosis.
Oh,
And that's always really fun. It's really
what
fun.
does that mean? A talent for clinical hypnosis?
Yeah. So just like anything in the population, talent for hypnosis is on like a bell curve, right? So you've got these few people that are just prodigies. They're amazing. Like I've got this video I'll sometimes show people of someone getting surgery with no anesthesia.
Whoa.
Their eyes are open, they're talking to the surgeon, they're cutting open their stomach, they're repairing a hernia while they're having a conversation, and they're in self-hypnosis,
Wow. Okay.
completely in control, right? So those are like the prodigies. The good news is we don't need you to be a prodigy because we're not going to need to cut open your stomach to do this, right? We've got anesthesia for that. We're good. But the other side of the bell curve are the small group of people. It's just like talking to a stone wall.
Mm.
They can't figure it out. They can't get it. So we've got these two groups, but the majority, the big hump in the middle, they're good enough. They're good enough to work with in order to help with their problem. So we're just making sure that we don't need them to be awesome. We just need them to not be terrible. And we're good. Yeah. So sorry, go ahead.
What does that test look like?
Yeah. There's a bunch of different tests. One of them is, I think, very similar to a game kids have been playing with each other for years. Do you ever remember playing with your friends the finger magnets game?
No.
No? Oh my gosh. You want to try it?
Yeah, sure.
Awesome. Okay. So put your hands together like this. See how my hands, yeah, perfect.
Yeah.
And then put your fingers apart like that. And then look at the gap between your fingers as if it's the only thing in the world right now, right? And keep on staring at that gap. And then begin to imagine that there's something pulling those fingers together. And just notice what the fingers do. And all you're doing is just imagining there's something pulling those fingers closer and closer. Good, good. And then just keep imagining. Yep.
My count. Could you cut out my gut?
Yeah. So now here, take your hands apart, let your fingers go back to normal. So normally when we do the test, we'd let the fingers come all the way closed and touch.
Yeah.
But did you notice those little movements starting?
Yeah.
So what that was, and we often use these tests also to do psychoed too, right? So what you were noticing is the power of your imagination to create changes in the body, right?
Mhm.
Because you were making your fingers move, but at the same time, you weren't making them move. Does that make sense?
Absolutely. Yeah.
Yeah. And you were noticing these little twitches, and that is something called ideomotor movement. And that's a signal of unconscious movement. So your unconscious mind was creating this little movement in your fingers, right? And so what we're doing is we're learning that we have an unconscious mind and a conscious mind, and we're learning how to use our unconscious mind to do helpful things for us.
Yeah, I like that. You have a helper. And,
Mhm.
certainly there are some kids who by themselves will come up with anxiety interventions that I teach other kids, and they themselves will be like, I lock it away
Yeah.
in a box so that I can
Yeah.
sleep. Right?
Yeah.
So those kids they might be closer to the cut your gut open.
Yeah.
Yeah.
And kids in general are just better at hypnosis because they're more flexible and they've got good imaginations. And using your imagination and focused attention, those are the two things you need to do hypnosis well.
So to simplify it, because
Yeah.
obviously it's going to be very personalized and individual. If I can make my fingers come together, I can
Yeah.
also probably start managing some gut symptoms.
Yeah, exactly. There's another one of the tests. We won't do it here because it takes a little bit longer, but where they'll make one of their hands warm and the other one stays the same temperature. And then they can literally touch it and feel the difference. And they created that change with their brain, with their imagination.
One of the things I really love about this is, of course, kids who have anxiety and are feeling crippled by it feel terrible about themselves. They feel
Yeah.
weak. They feel
Yeah,
like they're troublemakers. They know people are frustrated with them. And this is very empowering. Be-
absolutely.
so,
Yes.
so they're, even though you haven't even started doing the particular work, you are changing the way they think about themselves.
And that's really the trick. When we start doing the tests, we're already intervening. We're already making changes. We're building self-efficacy and confidence, right? And here's the thing, hypnosis pairs amazingly with treating anxiety. And here's why. I think you already know, but I'll tell everyone listening too. If you think about anxiety as imagination misapplied, right?
I
And
love
what are we doing with hypnosis? We're teaching people how to use their imagination in an empowering, powerful way. You're directly addressing the problem of anxiety.
I love this. I love this because, I tell people, if your kid has an anxious brain, we can expect anxiety to be something they dance with their whole lives.
Mhm.
And they have to learn how to cope with the reality that, as Joseph Ledoux says, they're a little more sensitive. They're just
Yeah,
a little more prone to go, which
right.
I want a surgeon who's got some anxiety, right?
Right.
But you're
Yeah,
helping them learn how to manage this forever.
yeah. Because if you think about it, imagination is a core process in getting anxious. If someone has no imagination, they can't get anxious. Because in order to get anxious, you have to imagine something, right? But if you can teach people how to better manage their imagination, you're helping them to better manage their anxiety.
When they talk about athletes and mindset
Hmm.
and they're imagining themselves being
Yeah.
successful, is that almost a form of self hypnosis?
Yeah. So hypnosis has long been used in athletics. The interesting thing to me is that it often gets called something else.
Mm,
So there's a guy, Dr. Unisthal, I think he was in Sweden. He was the one who came up with the whole concept of mental training for athletes. His specialty was clinical hypnosis. But at a certain point, he was like, this whole label of hypnosis is too much of a pain in the butt because people have so many misconceptions about it. I'm just going to
yeah.
call it mental training instead. And so he took it and he's using all these hypnotic techniques and he's calling it mental training. And it's popular all over Sweden. Um, it's the same thing. It's the same thing. It's about focus and imagination. And then the last part of understanding hypnosis is understanding that all humans have a natural state of consciousness called trance. And we naturally go in and out of trance. Anyone who has kids, I've got two, understands that their kids go into trance. They get lost in their world, right? Everything else fades away while they're playing. And you might call them a couple times and they might not even hear you, but that's because they're in a trance, right? Or they go into trance. If you've given your kid a phone, hopefully not too early, even if they're just holding the phone, they're probably in trance, right? Trance is happening all the time. It's very normal and natural. What we're doing with hypnosis is we're teaching people how to use it on purpose, how to go into trance on purpose and to use it deliberately. And if you combine trance with deliberate use of imagination and focused attention, that's almost everything you need to know about hypnosis.
And of course, we're talking about kids because that's the focus of my podcast, but
Yeah,
you work with all ages.
all ages. Yeah, but I spent most of my time working with kids, and I still do. Um, Usually it's 8 and up, but I think hypnosis has some good research at 6 and up that can be
Interesting.
helpful. Yeah.
I mean, that makes sense because like you said, you do have to project yourself into a future. You have to have dread to have
Uh-huh.
anxiety, and that is a developmental. It's not
Right.
that younger kids can't be anxious, but it's
And
developmentally appropriate at a certain. It's like
Yeah, and
five,
I think the
six.
anxiety when they're younger tends to be more conditioned than cognitive. You
But
know,
yeah, but even then, I'm thinking, so I'm trained in space. My
yeah,
work is generally with parents.
yeah.
But I would say if you're struggling with your 3 or 4 year old's anxiety, you might benefit from
Oh,
looking into
yes.
hypnosis, maybe, because it's about
Yeah.
tolerating your discomfort with your child's discomfort.
Yes, absolutely. Because as anxiety is a transmissible disease, transmittable disease, sorry. um,
Yeah.
that because let's say you've got a kid that's born a little more sensitive, they pick up on the vibes that are around them. But then you've got like a dad that's super anxious. You don't think that kid is going to pick up on those on that energy, on those all the body language, all the little cues. Of course they are.
Yeah. I'm so intrigued by that. How did you get into this?
Yeah, so I was fascinated by hypnosis as a tool, which then prompted me to switch from about to do a PhD in biochemistry to psychology. And so I started with a love of hypnosis and then built everything else around that. So I've been using it integrated into my practice from the beginning. And so I was just a generalist. And I didn't actually know what an amazing tool it was for GI problems, but I discovered it. I had a patient who had IBS and I started researching. Oh, okay, I'm seeing here that hypnosis can be a good tool. Let's try it out. And it just worked amazingly. And then the next patient that had IBS, and then the next had some other gut problem, and then the next had some other chronic pain issue. And so that slowly became my expertise is specifically working with these people with pain, with chronic health issues, and then being able to work with children was also another differentiator because there aren't enough people trained to work with kids. And so I was getting good results with little kids. So then all the pediatric gastroenterologists in the area started knowing about me. Right.
Hmm.
And it just builds and it builds.
So, what made you so fascinated with hypnosis?
I think it's the ability to shift and change things that traditionally don't feel like are within our conscious control.
Hmm.
Right. So if my hands are a certain temperature, I just find it just amazing that people have the capacity to learn pretty quickly how to just change the temperature of one of their hands, but not the other, right? Or to take a 7 or 8 out of 10 level of pain and within 10 minutes, bringing it down to almost nothing, right? This to me was amazing. Like, why isn't everyone taught this, right? So as I'm reading about what's possible and what people have done in the past, I'm like, oh my gosh, this is amazing. I want to learn to do this. I want to learn to teach people this. And so that kind of passion, I think, propelled me.
Yeah, I'm feeling a little bit lost in the weeds as I'm thinking about it because,
Yeah.
one of the challenges of working with kids is you're asking them to be motivated to change. And they believe, rightfully often, that their anxiety is protecting them. And
Right.
I say rightfully because their anxiety allows them to avoid the thing making them anxious. But of course, it's much more
Right.
meta than that. I tell
Mhm.
parents you get really hung up on what and why they're angry. Why are you afraid? And the truth is they're afraid because they're afraid. They're anxious because
Mhm.
they're anxious.
Yeah.
And when you're helping them manage the symptoms, the pain,
Yeah.
you're not asking them
Yeah.
to give up their anxiety. But you've interrupted it enough that
Yeah.
then they probably are more likely to go, I guess I'll go towards that dog now that it doesn't make me want to throw up.
Don, I love your comments. So important what you just said because as a therapist, part of what I love about doing this work is something you just described. Because a lot of times I'm hanging out with the other therapists and they're like, really? GI problems? That's weird. But actually, I don't think they realize that these mind body problems, whether it's IBS or chronic headaches or whatever, they're an amazing entry into the system of working with this patient. Because, if I go to a patient that has social anxiety and start to work with them, that's not an easy job. There's going to be layers of resistance around doing exposure, about even challenging the fundamental assumptions of what they think other people think of them. And like, it's a long road to work with a socially anxious kid. It's definitely treatable. But if I got a socially anxious kid that has stomach pain, nobody wants stomach pain. But that anxiety about social situations, they want it because they feel it keeps them safe. So asking them to let go of it is tough. But it's not hard to get people to want to let go of stomach pain. And so by doing that, though, what are you doing? You're building trust and you're building therapeutic momentum. So now you've treated their stomach pain. They feel better. But you've also taught them affect regulation skills without even knowing that was what you were doing. Because hypnosis and self-hypnosis are tremendous affect regulation skills.
And is it effective too then with panic disorder?
Yes.
Now, see, here's my problem is now I just want everybody to come see you.
The good news is I spent the last 5 years taking everything I know and then more so building an internal training program for our team. So we've got, I think, 17 therapists now. And they all have to go through our internal university. They're already good therapists, right? And then we hire them and then we train them for another 9 months.
Wow.
On how to use hypnosis, how to apply CBT to these mind body problems. How do you work with chronic pain? How do you work with not? Like, there's so much that they need to learn. So they don't have to just see me anymore. And that's the reason we started this originally, is I was full and I was in the DC metro area. And this is an area with tons of therapists. You throw a rock and you hit a therapist around here. But there was literally nobody on an outpatient basis who could see kids with GI problems, right? And who were trained to use the tools that had an empirical basis to them. There's nobody but me sitting around. And of course, then I was full. So then what do I do with these kids? Right?
So now you've got, we talked earlier, you're in all 50 states.
Yeah. So we're in all 50, because our mission, so the practice is called just GI Psychology, and it's gipsychology.com. And the mission is to make these treatments available, because it just seems so crazy to me that we have these treatments that are so effective, that we have tons of research for, and that there are so few people trained to do them. So the mission is we want to train more people. We want to educate medical professionals out there so they can know that these treatments are now available for their patients. And then we want to make it available easily. So we're telehealth in all 50 states.
And you can do hypnosis via telehealth?
Yep. I had to figure that out right when COVID hit.
Yeah.
Right? Because I was all in person. That's all I'd ever done. And then suddenly it's, oh, we're doing a video call now. Let's figure this out. And so you try it and it works. And then they later on do research showing that it works in general to do.
And you said, so kids as young as 8, do you go any younger than that, or are they better in person?
Kids as young as 6.
At 6. Okay.
But the caveat is we've got a group of clinicians that are specially trained for the really young ones. Almost all of our clinicians, we make sure that they can see patients like 12 and up. But the younger ones, they take specialized training. So that's like a smaller group of clinicians within the group.
If I'm a parent then, I can reach out to you directly through the website. What if I'm a clinician interested in learning more about either referral or training or working with you?
Yeah, just email me directly. So it's just, let's see, the easiest email to remember would just be A Navidi, A for Ali, and then Navidi, my name, at gipsychology.com.
Yeah, and I'll put all
Oh,
this stuff in the show notes too.
yeah.
Yeah.
Yeah, but I
Yeah.
love talking with different clinicians. I could talk about this stuff all day.
I could listen to you talk about it all day.
Thank
Like
you.
I mentioned this a little bit, but when I first got your pitch, like I said, I get a lot of pitches about GI health, and I
Yeah.
usually dismiss it right away because it's somebody who's selling a formula
Yeah.
or saying that all anxiety is related to gut and ignoring the brain entirely.
Okay.
And so when I first thought, I went, oh, no. But then I read it and went to your website and went, oh, I can't wait to talk to this guy because I feel like I've wanted to talk about this topic, but
Yeah.
I couldn't find somebody reputable with the science behind them that I felt like was actually going to be helpful for parents to hear because as parents with kids who are really struggling are very vulnerable to quick fixes.
Of course, I'm a parent too. And when my kids are suffering, I'm desperate to make them feel better. And if the first round of things that you try doesn't work, you go to your doctor and all the tests come out normal. And then you're like, okay, now what? What now? So then you start diving into the internet. And we all know what happens when you dive into the internet, right?
Yeah. So there's someone on TikTok going, you need to eliminate, I'm making this up.
Yeah.
Obviously, I would never, you need to eliminate apples and then
Right.
you're cure your kid. And you go,
Right.
maybe it's just that easy. And
Yeah.
yeah.
Or maybe you just only eat apples. I don't know. Right.
Yeah. Yeah. And what I appreciate about what you're saying is it is, I won't say that it's easy, but it is, anxiety is very responsive to treatment. It really,
Yes.
really is. If you have a kid with somatic symptoms, and most kids have stomach aches or headaches,
Yeah.
then yeah, intervening with the somatic symptoms absolutely makes sense. And this
Yeah.
seems like for parents also who are a little cautious about medication.
Oh, yeah. Actually, so there's an organization called, I don't remember what it stands for, but it's NASFAGAN. That's how you say the little acronym.
Huh.
But it's basically the Pediatric National Gastroenterological Association. So NASFAGAN is the one for the United States. SFAGAN is the one internationally. They recently came out with their guidelines in 2025 for the treatment of functional abdominal pain, like stomach aches, and IBS. You know what they put above every other thing out there? No medication, no supplement, no biofeedback, no anything, no diet. Number one is gut focus CBT and clinical hypnosis. Boom. Right.
Crazy.
Yeah.
And if you got someone in your office who you realize there's something more in the picture, then it sounds like you have a referral network too
Yeah.
to help
Yeah.
parents connect with what might be next.
Yeah. And so there can be complications, right? So maybe they actually have D, so inflammatory bowel disease. So that's ulcerative colitis or Crohn's. This is why we need a good medical checkup. Or if symptoms suddenly change, let's say you're dealing with someone with just tummy aches, but the nature of them changes, or there's blood in their stool, or there's something else that shifts, you need to get that checked out. There's also something called SIBO, small intestinal bacterial overgrowth, right? And I think sometimes people over focus on that, right?
Mhm.
But it's a real thing and it is also treatable and diagnosable. So that's something that should be ruled out. And your standard gastroenterologist or even sometimes your primary care can test for that as well.
Yeah, because we do need to take care of both. But as you said, with our imaginary patient, she
Yeah.
really did have food poisoning, but it flipped a switch in her brain and we need to flip that back.
Yes,
Yeah.
exactly. Exactly. And then, as you know, then you've got the door open. You've just treated this stomach pain. You've taught them how to make it go away. and they're like, oh, I guess you could help me with this because I get nervous before school. I'm worried about what my teachers are going. Oh, okay, we can talk about that too. Do you remember that technique we taught you about how you use hypnosis to do that? Actually, we can use that too, right?